Welcome to Getting Understanding with Dr. Daryl Ellis. We're back again talking about the same topic we've been talking about now for about a year, and that's COVID-19. If you guys are as tired of hearing about this as I am about talking about it, then we need to get together and start doing something to make sure that this is no longer a topic, that this is no longer something that we're continuing to have to face, continuing to have to try and prevent, and continuing to try to have to battle and treat moving forward. We've talked about what's so necessary in terms of prevention, in terms of things that we can do to try and help get this viral infection back in the box that it got out of, so that the rates of infection, the rates of sickness, and the rates of death continue to go down and stay low. We are currently at a point in this country where we're seeing the lowest numbers of hospitalized and dying people from COVID-19 since this pandemic started 2.5 years ago. And that's great news. Unfortunately, people are taking that great news out of context. And there is a growing feeling around town and around the country that the pandemic is now over. That could not be farther from the truth. In fact, the Omicron variant of COVID-19 that we just got through dealing with in this latest wave of infection has, and we talked about this in an earlier video, has mutated again, and it's now a subtype of Omicron called BA.2. BA.2 is a little bit different from the original Omicron variant in that it actually is much more easily transmissible than the original Omicron. And the original Omicron was more easily transmitted than the Delta variant that preceded it. So we're seeing this trend occur where, although we're not seeing as many hospitalizations and we're not seeing as many deaths, we're seeing these variants that come out that spread very rapidly and cause high numbers of infections, to the point where in many communities they've stopped tracking the actual infection rate and are now only tracking the hospitalization and the death rates. Why is this important? Because even though the BA2 seems to not be as virulent, meaning it does not cause as much serious illness and death as the prior variants, we have no idea what the next variant of BA2 might be like. So it's very important that we prepare for this latest surge to try and prevent, once again, additional spread, additional mutations that can lead to additional serious illness and death. We're in kind of a window right now where the opportunity is now for us to do what we have to do to prepare for what we believe is to come. And that is yet another wave as we go into the fall and winter months of 2022. So what are the things that we can do? Well, there are 7 basic principles that I'd like to go over with you that we can do now so that we're in the best position as possible to be able to be prepared for what is yet to come. Pay attention to the COVID indicators in your community. You can go to the cdc.gov website and pull up your county or your state, and they'll tell you what the transmission rates are for your county or state. You can just plug it into a little table and it'll pop up. And they have different color indicators to decide whether you've got a low, moderate, or high rate of transmission in your community. If you're in the red, then that means that this stuff is spreading all around you, and you need to be extra careful in terms of the things that we've talked about over and over again to prevent yourself from becoming ill. Frequent hand washing. Make sure you're wearing a high quality mask if you're in an indoor environment where there are large crowds of people and you can't practice 6-foot social distancing. Be sure that you have been well immunized, meaning that not only have you had the first 2 doses of an mRNA vaccine, but that you've also been appropriately boosted. We'll talk about the second booster shot in just a minute, but we're going to stay right there for that. The other thing that you can do is be sure that you are getting your children properly vaccinated. If your children are over the age of 5 and they're attending school and you're in one of those red areas on the CDC website, try your best to get your children vaccinated. Kids can be vectors of viral infections. We see that over and over again. They very rarely follow the protocols when it comes to 6-foot social distancing. They very rarely follow protocols in terms of keeping their hands out of their mouth and out of their faces or out of the mouths and faces of some of their classmates. So they are vectors for which not only to contract it, but to also spread it to other family members when they come home from school. So that's something that's very important to do. The other thing that's very important, and I've touched on it just a second ago, is make sure that you, particularly if you are or live with someone who's in a higher risk category for serious illness, have not only been vaccinated, but also have been boosted. Right now in this country, less than 75% of people over the age of 65 have received their booster shot, which puts us in a position where there are a lot larger numbers of people who are at risk for serious illness, hospitalization, and death than is really acceptable. And that's with the current level of infectivity with the BA2 virus. Again, there's a possibility, and it's more of a probability than a possibility, that we'll see additional variants from BA2, which may reverse the trend and become more virulent and more deadly than the one that we're currently facing. So again, the things that I'm recommending are things to help us to prepare for what seems to be inevitable. This thing is not going away anytime soon. We talked about it before. Our opportunity to really get rid of this happened about 1.5 years ago. We missed that opportunity, and now we've got to deal with what we can do to try and keep the rate of, if you will, morbidity and mortality, sickness and death down to a minimum, particularly in the subpopulation that is at greatest risk. The elderly, the people who have chronic illness, and the people who are either on immunosuppressive therapy or suffer from immunosuppressive or autoimmune diseases. Those are the people that are more likely to develop severe sickness and suffer from mortality or death as a result of one of these viral infections. Now, so those are the things that we can do just with respect to COVID-19 and the variants that are to come. The other thing that we need to do, and we kind of touched on this earlier on in previous videos, is those of us who suffer from chronic illness, whether you've got cardiovascular disease, hypertension, diabetes, if you have an autoimmune disorder like lupus, sarcoid disease, rheumatoid arthritis, all of those things that put us in that high risk category, we've got to be sure that we're doing our part to absolutely be sure that we are trying to keep those medical illnesses under the best level of control as possible. If you've spoken with your physician and they put you on a meal plan specific for your medical problems, be sure you're doing your best to follow that meal plan. If you've been advised to do regular daily exercise to help boost your immune system, be sure that you're following that exercise program. If you've not been somebody who's had the ability to get good restful sleep, which is a very critical element in keeping your immune system vibrant and healthy, try and do what you can to create a good sleep environment so that you can maximize and optimize your sleep hygiene and get better sleep as a way of boosting your immune system and making you a healthier version of yourself. If you've not been consistent in following up with your primary care physician and or your specialty physician who may be managing your specific disease process, be sure you get back on track with that. Take your medications as prescribed so that you once again can help to prevent the sickness and the death that can occur from one of these viral illnesses, particularly if you're in a higher risk category. There's nothing we can do to make you younger, but if you're over the age of 65 and you have chronic illness, or if you're less than 65 and you've got chronic illness, you need to be sure that you're taking care of those illnesses and those disease processes so that you don't increase your risk. The other thing that I wanted to touch on is the second booster, the fourth shot. It's already been approved this week for people who are over the age of 65 or people who have some of those chronic illnesses that I just mentioned. If you're a healthcare worker and you're in an environment where you have a high risk of infection and you're over the age of 50, you also are considered to be eligible for this second booster shot. Now, when should you take the booster shot? Well, if your first booster shot occurred more than 30 days ago, then it's time for you to go ahead and get it done. If you are somebody who is interested in waiting until after the summer because you want to go on vacation or you want to do some other things, well, that's okay. But I certainly would recommend you not wait beyond August of this year to get that booster, because it's probably in the fall that we're going to start seeing more of a surge from either this BA2 or of a new variant of BA2 that you're going to want to have yourself protected from. The other thing that you can do to help prepare yourself for the next wave is if you have big family gatherings, if you got vacations scheduled for this summer or early in the fall, you want to make sure that you have a backup plan so that if you've got a wedding planned, if you've got anniversaries, birthday parties, those kind of things coming up, that you have an outdoor plan in case your county, by the time that the event is scheduled, is now in one of those red zones. You can provide a safe environment for those who you're inviting to your event. Or if you're going to the event, you can ensure that those who are putting on the event have provided a backup plan so that you're not putting yourself in a higher risk situation. So again, this is just preparation for what we know is coming, and we just don't know just how serious it's going to be. But the best way to be prepared for everything is to prepare for the worst. So take these tips, try and put them in place for yourself and for your family, and hopefully as we face this ongoing pandemic, these ongoing risks of infection and sickness, we'll be in the best position possible so that it doesn't affect us adversely. I thank you for paying attention. I really do ask that you click that like, click the subscribe, and send me some questions. It really helps in terms of developing content. I'd like to be able to talk more about issues other than COVID-19. But to find out what you want to hear about, I need to hear from you. God bless you.